you doing? My name's Joe Williams. I'm a Wiradjuri Waggaloo man and lucky enough to call Dubbo home for the last 10 years. Lucky enough to do lots of different work in the wellbeing space over the last decade, and been tied up doing different things for the PHN, in and out throughout the last 10 years as well. It was probably a little bit remiss of us before we started. I know that everyone, evacuation points and things like that, I'm the sort of bloke that just runs. Without listening to people saying, here's the evacuation point, Joe. No, I'm out of here. If there's danger, I'm out of here. Do your best. Um, Politely saying. But thank you for joining us here today. I'm going to have some robust conversations, which is fantastic, and for the official launch of our wrap, I'd just like to invite up CEO Brad Porter to the stage to officially launch the wrap and give his CEO address. Thanks, Brad.
Yurder Marang, Muji Galang. Good day, my friends. I'm deeply honoured to be here with you all today as we officially launch Western New South Wales Primary Health Network's Innovate Reconciliation Action Plan. This is a milestone for our organisation, but more than that, it's a moment that highlights our ongoing commitment to creating a more inclusive, respectful, equitable future for all. Your voice will be heard here at the PHN. Today, we're here to celebrate not just a plan, but a vision and a journey. A promise to continue working hard, hand in hand, with First Nations people, respecting the history, culture, and contributions that have shaped this country. Our Innovate Wrap represents a step forward in a journey that is as old as Australia itself. A journey of healing, listening, learning, and growth. We warmly welcome and thank Lewis Burns and the dancers for his welcome to country. Always has been, always will be, Aboriginal land. I acknowledge elders of the Wiradjuri Nation, their wisdom that guides us as we move forward on this journey. And we are committed to honouring and incorporating First Nations perspective into everything we do. This commitment is not just about recognition, it's about action from hearing the voices of First Nations mob. Our wrap is not a document, it's a call to action, a structured commitment to reconciliation, and a guide for embedding our cultural respect and awareness into every aspect of our work. It sets a roadmap for strengthening our partnerships with First Nations people, creating a culturally safe environment for our employees and the communities we serve, and building on the significant steps we've already taken in supporting equity. One of the aspects of this wrap is to grow partnerships with First Nation service providers, which brings us an invaluable collaboration to form growing First Nations workforce. It's not enough to speak of reconciliation without action. Building a strong Aboriginal-led workforce within the healthcare sector allows us to provide culturally safe and amplify First Nations voices in leadership. It gives us the skills, knowledge and wisdom to shape a healthcare system that truly serves and respects individuals. Through initiatives, we'll not only be filling important roles, we're also ensuring that our workforce reflects the communities we serve. Representation is crucial. It means First Nations Australians will see themselves in the services provided, feel recognised, and know they have a place in the decision-making process that impacts their health and well-being. Our service provider partnerships with ARCHOs serves as a model of what we can accomplish when we come together, aligning our vision and our values with purposeful action. But let me be clear, while the wrap offers us a direction, it's ultimately our responsibility as individuals and as an organisation to bring this vision to life. Each of us has a role to play in driving reconciliation forward, and it starts with commitment. This commitment means listening to understand, learning from the wisdom shared with us, and ensuring our words are backed by action. It requires a continual reflection on the role we play in creating an inclusive workplace and healthcare environment where everyone can feel safe, valued, and respected. In the spirit of this RAP, we commit to expanding our cultural awareness training, equipping our teams with knowledge and understanding needed to interact with cultural sensitivity and respect. We will continue to embed respect the First Nations culture in our work environment and ensure that cultural perspectives are centre to our policies, programs and services. This is an ongoing journey. It's about making progress every day, step by step. Our RAP calls us to take those steps to make reconciliation part of our daily lives and business practices, to be part of a future that cherishes and uplifts First Nations communities. I want to take a moment to acknowledge and thank the many individuals and teams who have worked tirelessly to bring this RAP to fruition. It's a culmination of countless conversations, ideas and efforts, driven by a shared commitment to a better future. Thank you to our First Nations advisor, Dixie Crawford from Ngunya, whose perspective and voices have been invaluable in shaping our approach and guiding our steps. I want to recognise the strength and resilience of First Nations communities across Western New South Wales. Despite facing significant health and social challenges, these communities continue to inspire us with their resilience, their culture, and their knowledge. It is our privilege to learn from and work alongside you, and we will continue to listen, support, and stand with you. Today, as we launch the Innovate RAP, let it be a reminder that reconciliation is not a destination, but a journey that requires dedication, respect, and courage to change. It is a commitment to continuously improving our systems, to building trust, and to shaping a future where every person, regardless of their background, has access to care, respect, and opportunities they deserve. Together, we will be making strides toward a brighter future. I'm excited about what lies ahead and am inspired by the strong foundation we have today. We are here for the long haul, committed to making our health network one that not only serves communities, but is truly part of them, uplifting every individual along the way. Thank you all for being here today, for your commitment, your passion, and your dedication to the vision of reconciliation. Let us carry this commitment forward in everything we do, ensuring that this RAP becomes a legacy of respect, inclusion, and partnership. Mandanguyu. Thank you. I also, while I've got the mic, want to take this opportunity to introduce our fabulous MC today, and I'm truly honoured to introduce our keynote speaker and MC for the day, Wiradjuri man Joe Williams. Joe became an author and a mental health advocate after a 15-year career in boxing and rugby league. Despite his successful professional sporting career, Joe battled most of his life with suicide ideation and bipolar disorder. After a suicide attempt in 2012, Joe's purpose was clear: to support others struggling with mental health and well-being. Joe has contributed to numerous books, as well as penning his autobiography entitled Defying the Enemy Within. Joe was named the finalist for the Courage Award in 2017, National Indigenous Human Rights Award, and 2018 was awarded the Suicide Prevention Australia Life Award. In 2019, Joe was awarded Australia's highest honour in the mental health field, announced as a co-winner of the National Mental Health Prize presented by the Prime Minister. Since founding the organisation The Enemy Within in 2014, Joe has delivered wellbeing programs to over 200 communities across Australia and multiple countries around the globe. which aims to alleviate the mental and traumatic distress of individuals across community. Joe is also an adjunct professor of the School of Psychology of the University of Queensland and was recently accepted into a PhD program with the Indigenous Knowledge Institute at Melbourne Uni. We now have a few more speakers, which I'll hand back to Joe, but please welcome Joe Williams.
It's always, I won't lie, it's always awkward hearing things like that. When you, for the record, I don't send my bio through, so someone else sends it through for me. So I'm not here. I don't like talking about myself a hell of a lot, particularly, I guess, as the sporting career stuff. Like sometimes we can form an identity around what that was rather than what it is. I certainly attest to not being that anymore. Not, as far as I love sport, I watch sport, I identify with sport, but it's not who I am. And my struggling hips and knees most days and mornings will attest to that. We're going to call up a couple of other speakers now as well. Firstly, I welcome the Western New South Wales PHN Board Representative Julie Toma to give an address from the board. Julie is passionate about making a difference in her work. Julie's career spans senior executive leadership roles for global healthcare corporations including Sonic Clinical Services, Cochlear, Kimberly-Clark Healthcare and Becton Dickinson, as well as non-for-profit sector C-suite roles covering healthcare, aged care, allied health, mental health and social services. Julie's expertise lies in the business strategy, marketing, customer and employee experience, philanthropy, transformational growth and stakeholder engagement. Welcome, Julie.
For those standing up the back, there are some spots down here at the front in the shade, so you're very welcome to come down and join us. Good morning, and in the language of the Wiradjuri, Yuradu Marang. Good day. It is an honour to join you today on behalf of Western Health Alliance's board to celebrate the launch of our Innovate Reconciliation Action Plan, our commitment to strengthening community relationships, respect and opportunities together to create inclusive, equitable health and wellbeing outcomes for all. I'd like to acknowledge the traditional custodians of our lands and pay my respect to the Wiradjuri, whose ancestral lands we are metering on here today. Western PHN covers a huge region of over 430,000 square kilometres with a population of over 300,000 people. From the Three Rivers Regional Assembly, reaching from Lithgow to Nyngan, and the Murdy Paki Regional Assembly, whose lands stretch from Broken Hill through to Lightning Ridge. Of the 31 PHNs, we are in the top 3 in terms of proportion of First Nations people, aside the Northern Territory and Western Queensland, with 11% of our population identifying as First Nations. In a beautiful artwork commissioned for our Reflect Wrap in 2021 by Nathan Peckham, who I believe is speaking later in the program, titled Past, Present and Future. It depicts a camp shelter made from gathered leaves thrown over a temporary shelter of branches. They are on a journey to find a new home to ensure the survival of the tribe. The central dreaming trails represent where they came from, where they are going and where they want to be. This artwork symbolises the journey we are undertaking with our wrap. The aim of our journey together is to reach a place of unified understanding with First Nations people through recognition of past, understanding of present, and celebrating the future. I've been fascinated by the global blue zones research, where anthropologists studied small pockets of people who have the world's healthiest, happiest, and longest living populations, with many living to be centenarians, living to over 100 years of age. Interestingly, the key similarities these communities from remote corners of Japan, Greece, Sardinia, and Costa Rica all have in common is not what you might expect. They walk walk a lot as part of everyday life. They have a deep sense of purpose. They use meditation, rituals, or prayer to help manage stress. Social connection and spirituality are central to their culture, and intergenerational family relationships and support networks are highly valued and respected. Many of these themes we can learn from First Nations communities. Social and emotional well-being is the absolute foundation of physical and mental health, encompassing connection to land, culture, spirituality, and ancestry. In research published by the Health and Wellbeing of First Nations People by the Australian Institute in July this year, life expectancy and the burden of disease for First Nations people living in remote areas is lower than it should be, with the leading causes of illness including heart disease, diabetes, respiratory diseases, cancer, and intentional self-harm. Reduced quality of life is also impacted significantly by mental health. Disruption to family and kinship connections, including intergenerational trauma, have strong links to poor mental health. We know that differences in education and employment opportunities, access to appropriate culturally sensitive health services, housing circumstances, and other factors, such as availability and cost of fresh produce, are all incredibly important. At my first board meeting here in the region, on a very hot January summer's day, so hot that you could see the heat rising from the pavement, our flight was significantly delayed and we spent the afternoon waiting in town. It broke my heart to see a beautiful young girl, perhaps 14, and a similar age to my own girls, looking disorientated, scratching at her face and arms and pulling at her clothes. I am certain that when her mum, dad, aunties, and extended family welcomed this beautiful child into the world, they wanted her to thrive and have a happy, fulfilling life. It is not okay that the postcode one is born in can impact equity and access to healthcare in this great country of ours. Together, we can ensure this story and others like it have a happy ending, an ecosystem where this young teenager, whose life is ahead of her, receives the support she needs to recover and thrive. Together, we can be the catalyst for a better future. Only through reconciliation can the journey of healing, listening, learning, and partnership move the dial on health and well-being outcomes for the people and communities we serve. I'd like to particularly acknowledge and thank people who have contributed to the launch of our Innovate RAP today, including Reconciliation Australia, our CEO Brad Porter, who serves as the chair of the RAP working group, board directors Melina Saunders and Michael Newman, and our chair Robin Williams, Donna Stanley, Aboriginal Health Advisory Council members, Dixie Crawford, as well as PHN team members representing people and culture, communications, suicide prevention, and procurement. I'm particularly looking forward to attending a Western New South Wales Aboriginal Health Symposium with planning underway with ACHOs and other key stakeholders um, for 2025. And I'm excited about the opportunity for us to create a more inclusive, respectful, and equitable future for all. Thank you.
Thank you so much. There's so many home truths in those words, and I invite everyone to start to dive into that a little bit and have a think about what those words mean, because sometimes words can just gloss over. And I guess speaking particularly as an Aboriginal man, we've heard a lot of words, and words when words without action, particularly when we're doing things like doing our best to build a relationship in a country, there needs a bit more, I guess, commitment individually, and what that looks like to take off the blinkers of every day of what we see and how we approach things, and start to learn a little bit about each other and how we do it. I'd now like to call up and introduce Dixie Crawford, um, who was the RAF consultant for the Western New South Wales PHN. Dixie is a Barkindji woman born in Broken Hill who lives and works in Yamba country in Brewarrina. She founded Nganya in 2018. Nganya means firelight in Barkindji language. And when we meet Dixie, you'll understand why. I'm under strict advice not to read any more of the bio, so I'll let Dixie come up and tell her story. And again, as I said, I've known Dixie for a long time, and you'll understand why her company means fire.
Well, it's shame reading your bio. But in saying that, I know that all our old people are very proud of us when we, when we talk about the things that we've achieved. And yeah, it is shame, but anyway, good ways. Good morning, everyone. My name is Dixie Crawford. I'm a Barkindji woman from Broken Hill and live and work on Nambar country out in Bree. I want to also acknowledge the Talbragar people of the Wiradjuri Nation and pay my respects to elders past and present. It's lovely to be here. My preference would have been in July, but never mind now, because it's too hot here and I'm worried I'm going to get sweat on my top lip here and my hairs will kind of come together, because we all got those moustached. But I do want to acknowledge mob that are also here today, my fellow First Nations people, and pay my respects to you and your elders and your family. I, in particular, want to acknowledge my dear old uncle, Lawrence Crawford, who is now the chairperson of the Bathurst AMS. He told me it's the first time that he gets to see me in action today, so I better perform. Otherwise, I'll tell my mum and I'll get in trouble. Here he is, Uncle, you got your camera upside down. Other way. Here we go. He is known as a paparazzi person in the Crawford family. But I was engaged by the PHN, I think it was in late 2023. Sorry, I forgot what year we were in. It's all a blur. To work with the organisation on developing the next iteration of the RAP. And we had successfully moved through the deliverables of the Reflect RAP and we were transitioning into Innovate. And I came on board with the organisation really with the intention to push the boundaries. My job is never about asking safe, comfortable questions. It's always about pushing you past your safety zone and your comfort zone to realise where there is more potential around the impact that we can potentially make in the lives of Aboriginal people from the perspective of healthcare, social justice and health equity. So I have a background in health. I was a graduate of the Jurarang program down in CSU, the mental health program, and I learned a lot of my skills and I guess insights around lived experiences and health outcomes and how it is that we need to shape services that actually meet the needs of communities rather than fit within the comfort zone and the reporting frameworks of expenditure when it comes to funding for health. It's really important that we think about what we're doing and the impact that it makes in communities and not necessarily about how we meet the needs of some random policy officer who sits in North Sydney or in Canberra around deciding whether we do or don't get funding. So the intention that I have for you is the call to action is to reflect on where are we doing well and where can we be better, right? It's not actually about doing the bare minimum. Innovate is really, as a reflect framework, Innovate is about pushing the boundaries and looking at where we can make maximum impact on First Nations, in First Nations communities around making sure that we have accessible healthcare, because it's one thing to say that people have access to healthcare, it's another thing for mob to say it's accessible, right? And I really want you to reflect on that. I just wanted to share a little bit about what RAPs are and how they've changed in the context of in the context of post-referendum in this country from October last year. So prior to, so I'm a rap consultant, that's all I do. I don't work on anything other than raps. And it's really important for me that I wanted to master a skill set and a capability to provide advice, culturally sound, but also very strategic advice to organisations how to implement this, because one of the greatest things about the RAP, but also one of the biggest limitations, is that it's a standardised framework, right? And so regardless of whether you are a mining company, a plumbing company, or a healthcare company, your RAPs can all look the same. And unless we do the deep dive and reflect on who we are and where we want to be and what the purpose is of the RAP, then our RAP can just look like everyone else. So every other organisation. So reconciliation action plans, they have 4 pillars to them: relationships, respect, opportunities, and governance. Now, you can't have really good opportunities around change unless you have relationships with mob. You cannot have really good relationships with mob unless you have respect for our lived experiences. So these are foundational blocks that we need to be building on. So when you are developing or you are implementing a RAP, I really want you to consider a couple of things. The first thing is, what is your intention around developing a RAP? Is it the tokenistic process of doing it because every Tom, Dick and Harry has one? Because they do. There's about 3,800 organisations that currently sit in the RAP framework. And I will tell you now, a large proportion of those organisations don't exactly know who they are in reconciliation and what it is that they want to be contributing from an allyship perspective, but also from being a champion around having really uncomfortable conversations about racism. The other point that I want to share here is, what is the purpose of our RAP and how is it relevant to our organisation's day-to-day business? Because if we don't make it relevant to us, it's not going to be embedded into our day-to-day practice. It is literally going to be a strategic document that is really beautifully designed and catches dust on the, some CEO's desk, right? So it's really important that we understand who we are, what we want to do, and how it's relevant to our day-to-day, because everyone has to see the RAP in motion, in progress. The final point that I want to share here is, when you are developing this RAP and you're implementing it, what's the impact, right? It's not the transaction of yes, we've done this or no, we didn't. It's really about what's the impact. So what is the impact on First Nations communities, and has it made a difference in the way that we see each other, right? The way that we reflect on the history of this country, but the way that we understand our present to redesign what our potential future could be. So I really invite you to reflect on that. Just 2 final points that I want to leave you with here. One of the challenges that I know happens for organisations when it comes to implementing their RAP, your eyes will only see the things and your ears will only hear the things that your brain is constantly looking for, right? So when you are getting to that edge of potentially doing something different, thinking about something different, I really invite you to think about, is this the standard that I'm setting for myself? Or am I adopting the norms that sit outside of myself in terms of the way that we see, hear and understand and act on the advice from First Nations people? That's it from me. Thank you very much for your time, and thank you to Brad and Donna for choosing to work with me. I've really appreciated it, so I can buy my land back.
As we can all see, firelight by name, firelight by nature. I now like to call up the artist behind our beautiful artwork that we see all over today on our shirts, on the publication of the RAP, also on our cake. Nathan Peckham, as you see, beautiful artworks all around the place. From Yarra Creative. Although a contemporary artist by definition, Nathan leans on the teachings of his elders and chains them to a rich mixture of modern media methods to give life to his new unique brand of artwork and design. Nathan connects to his audience by showcasing the many facets of Australia's rich Indigenous culture, and in particular the depth of culture specific to the Dubbo region, which is his ancestral homeland. A direct descendant of the Tubbagar clan within the Wiradjuri Nation of New South Wales, the Peckham family is dedicated to the advancement and recognition of Aboriginal culture, art and culture. it is Nathan's objective to continue that undertaking by sharing his artistic talents and understanding. We welcome Nathan to step up and say a few words about this special piece. Or you can have the mic over there, in the shade. We might need a chair to put the microphone on.
All right. Thanks, Joey. Yeah, I was at the launch of the first wrap, which was in a boardroom in the PHN office here in town, and clearly had that setting in mind. So I chose a black jumper, which was really clever of me. So that's why I was over there. Before I speak, speaking of that launch in 2021, my mother was with me at the time. Coral Peckham, I'd like to acknowledge her. She was a teacher, a mentor, a best friend, everything you could have asked for. A lot of the work that I do now, it's on the back of her education of me. We unfortunately lost her this year, but she left behind a beautiful legacy with the work that she had done over the years, and it's my objective to, I don't know, in my way, to continue that work. So I'd also like to acknowledge elders, past, present, and emerging, and it's an honour for me to be here. I spend most of my time working in silo, bit of a stitch up, thought there was going to be a cup of tea in a small room, didn't expect all this, so excuse the nerves. The work that I do now, it's funny seeing Lewis perform earlier and speak, been a mentor of mine ever since I can remember, and he taught me a lot around art. But art, when you're a young kid, you don't really understand, I guess, the importance of the cultural language that we're communicating through art. Yeah, we like things to look pretty, and I think because when we hear art, it's like we want it to have some kind of aesthetic appeal. But for us, at its core, there should be lessons that go with our artwork. We're teaching lessons. We're telling stories. So it really does. That's where we do have that separation, I guess, from other forms of artwork. This artwork's no different. I wanted to tell a story, understanding where PHN was on its Reconciliation Action Plan journey, and having been part of, on the other side of working on raps myself. I wanted it to give, obviously, the initiative an identity, something that was visually representative of it, but also tell the story about, I guess, where the rap was coming from, where it was and where it was going, the diversity of the communities that the PHN works with, and anyone knows that, you know, it might only be 50 k's between towns, but the dynamics between those communities can be quite different. And given the area which the PHN operates, you know, that's a mighty undertaking. And just to capture, I guess, the idea of partnerships with partners outside of the PHN in order to achieve their reconciliation goals. So always a privilege to do this sort of thing. I'm in a fortunate position now where I don't create artwork just for the sake of putting it on a t-shirt, and not that they don't look good on the shirts, but the drive is really for there to be something meaningful that goes along with it, some kind of lesson or some kind of opportunity for the exchange of knowledge and experience. So again, thank you for the opportunity, the PHN. It's amazing to see it printed on everything. It doesn't look like that when I create it, but thanks once again. Congratulations, all the best for the future, and enjoy the rest of your day.
Thanks, Peck. Thanks a lot, brother. As everyone can probably agree that the artwork is stunning, and when it gets blown up to the size that it is behind us, you can really see the depth of detail that goes into it. So, brother, thank you very much for your words and talking about the importance of relaying messages and storytelling of who we are as people and who we've been for thousands and thousands of years. Um, it's funny you spoke about your mother. My very first interaction, I was I guess a guy who came into Dubbo through my relationship, and I was lucky to be working right across the country in doing the work that I do in the most remote communities to big cities and things like that, and I guess I was invited into communities a hell of a lot right throughout the year, and I was on the road 310 315 days of the year in there talking about the challenges of our communities. But I but I was always I always had pushback from this community. I was invited into 100 communities a year, or 100 invitations a year to do different communities right across the place, and I always had pushback from the community that I lived. Um, and once I understood why, and it was a conversation with your mother. Um, Once I understood why, I got it. I guess from years of getting a profile through sport and I guess jumping up and down and making noise about different things that challenge our communities, on social platforms and so forth. You can sometimes let your ego creep in and think that you're entitled to do work in all places, particularly when you're invited into hundreds of communities across the country. I was always challenged as to why, and I got an invitation, and it was Mum, and I sat down with her, and she said, "Bub, I just want to know who you are. I don't need to read about you. I don't need to hear about you. I just want to know who you are and what your family is." And once I told her my family connection and who my family was, all of a sudden the exterior image of the guy who's on social media, on the news, who plays footy, who does all that sort of stuff, completely disappeared. And in that moment, it was about relationship building. And that's who we are and is who we have always been for thousands of years as people. And I think it's also key to what we need as a nation to move forward as a people, because it's no secret. We talk about things are divisive, people are divisive, comments, stories are divisive. If we don't understand that the community and the country that we live in isn't already divided, we need to wake up, because it's been divided for 230 plus years. So we need to go on that journey together, start to understand and build relationships together, because we've only learned about whitefellas for 200 years. You haven't learned about us yet. When we talk about relationship building, that's what it's about. It's about building a relationship with each other. I now like to welcome Donna Stanley up to speak as the Western New South Wales PHN Executive Manager of the Aboriginal Health and Wellbeing. Donna and I go back a number of years. The very first time we met in person was we were actually finalists of the Australian Mental Health Prize together. And that's when we first connected in person, and then we started, forming that relationship, building that relationship, and have worked numerous times together right throughout the years. I don't think Donna will talk about the longer relationship of our family. So welcome Donna Stanley. I won't go into it.
They even made it so I have to say something. So many years ago, I lived at a little town called Yass, just down near Canberra, and they have an annual touch competition there around the Australia Day long weekend. And Joe's father, Wilfred, always travelled to Yass for those events, and I had many a time enjoying those touch competitions with Wilfred. And I also know Joe's grandmother, Olive, who lives over at Cowra. I know several of his family members. I guess I know a lot of people throughout our region. So thank you, Joe, for being here and working with us today. And also I want to acknowledge Dixie and, of course, Brad and Julie from our board and executive. And my other executive members that are here with us, Janine, Graham, Michelle, who couldn't be with us today. So, yeah. So before I go on, I want to extend to Uncle Lewis Burns, who's probably left us by now, and thank him for his welcome to country, the gift of a smoking ceremony, and the use of ochre to bring us safely into today's celebrations. These acts of cultural sharing remind us of the deep connection of Aboriginal people and what we have to this land, and the significance of culture in all that we do. Uncle Lewis's presence and contributions today grounds us in the rich traditions of this country and highlight the importance of respect, healing and unity as we embark on the journey of reconciliation. As mentioned, my name is Donna Stanley. I am descended from strong, proud Gungri ancestors, and today I am blessed to be living, working and playing across the lands, waters and skies of the many Aboriginal communities that encompass the PHN's footprint. As someone who is deeply connected to Aboriginal culture and community, this moment is especially meaningful to me. Today we launch our Innovate RAP, a living document, a solemn commitment from the PHN to be humble, support and walk with Aboriginal communities in our region. It's not just an administrative milestone, but a powerful step towards reconciliation and creating lasting change. So why does this matter to me as an Aboriginal person? So I understand that health is not just about treating illness. It is about strengthening our connection to land, family and culture. For our communities, the challenges we face aren't new. The health disparities between Aboriginal and non-Aboriginal people are rooted in a history of dispossession, systemic discrimination and intergenerational trauma. But our resilience, it runs deep, and our stories of survival and strength inspire the work that we do every day. The PHN understands that addressing these challenges requires action. Reconciliation means listening to Aboriginal voices and ensuring that our health systems are safe, accessible and reflective of our culture. The PHN has made significant strides in partnering with our communities to address health inequities and to celebrate the strength of Aboriginal culture. So we talk about culturally safe health services. Through collaboration with Aboriginal medical services, the PHN supports care that respects our ways of knowing, being and doing. These services are lifelines providing both clinical care and cultural connection. Empowering communities, programs like the integrated team care are not imposed, they are co-designed with our people, blending traditional knowledge with modern healthcare to create solutions that truly work for us. And mental health and suicide prevention initiatives, the PHN has shown commitment to addressing mental health issues and suicide programs designed to provide culturally safe and trauma-informed care, helping our people heal from the inside out. There's also workforce investment. Building the capacity of the Aboriginal health workforce is central to this journey. When our people are at the heart of care delivery, we know that our services are more trusted and impactful. And I want to just take the time to acknowledge the people in the PHN, Aboriginal staff in there. So we've got Trixie, who's been here much longer than I have. So Trixie Watts, who works in our integrated care program. Fallon RC, who's one of our Aboriginal health and wellbeing managers, and Chrissy Jones, who's just joined us and will do some work around the suicide prevention space. So we are, making some inroads to improving and I guess extending what that workforce looks like. So our RAP is a roadmap for change. It represents our collective commitment by the executive, the board, and every team member at the PHN to deepen our relationships with Aboriginal communities, embed cultural safety into everything we do, and ensure that Aboriginal voices guide our journey. As we look toward the future, we know there will be challenges. Reconciliation is a process that requires courage, humility, and accountability. But we also know that together we are stronger. To our communities, I say this: we see you, we hear you, and we stand with you. Your resilience and strength inspire us, and your voices are at the core of this RAP. Today, as we launch the Innovate RAP, we affirm our commitment to walking this path with you, not as leaders, but as partners, listening and learning every step of the way. This is just the beginning. Together, we can shape a future where culture is celebrated, where health outcomes are equitable, and where reconciliation is a lived reality. On behalf of the PHN, thank you for your guidance, your patience, and your strength. And we look forward to continuing this journey together. Thank you. And I think I have a moment to just introduce Joe. Joe's actually going to do a keynote for us. It won't be very long. I'm conscious that it's warm out here. Joe did mention that we met back in 2019. We probably met at different times before that, but we really sort of consolidated our relationship back in 2019. As he said, we were both finalists. I was close, but no cigar. He won the prize along with a lady by the name of Christine Morgan. Some of you might know who that is, but she's actually she established the Butterfly Foundation, but is also the commissioner, the National Mental Health Commissioner. So we were in some pretty esteemed company back then, but we've also done other bits of work along the way. So Joe's going to talk to us a little bit about I guess what it means in our region, some of the stuff around, I guess, the trauma that impacts our communities and how we as a collective, and not just the PHN people, but all of our partners and stakeholders. I want to acknowledge Tony, who's here with us today, Tony Martin and Danielle Goolagong, both leaders in the LHD, Aboriginal leaders that, we do work together on some of these initiatives. So it's also about how we influence our partners and other stakeholders as well. So I'm going to hand over to Joe for a short keynote, and then we'll be able to move inside to the cool. So thank you, everybody.
Thanks, Donna. Again, I'm really conscious that we've been out in the sun for a little bit, and sometimes we can get death by a million speeches. So I definitely don't want to be that. I'm someone, I guess, as a former footy player and former boxer, one symptom that comes along with that tag is that I always have to have a USB everywhere I go to plug in so I can talk to it, because when I give or deliver sessions and speeches around different things, for someone who got punched in the head for a living, you don't remember a lot of stuff. So I had this wonderful speech this morning, but now I can't remember it. So I wrote down a few different things in my phone, I guess, as a PowerPoint. Thankfully, I never do this, but something obviously was guiding me a little bit bigger than me that told me to email it to myself. So I emailed it to myself. It's the first time I've ever done that, actually. Emailed it to myself, and thankfully I can just pull it open on my phone. So I'm a Wiradjuri Woggaloo man, and I guess for a lot of things that I say, or a lot of things that I did, or even a lot of things that get said about me, is that I'm the first to admit, I'm the first to acknowledge that those things are labels. And whilst I'm extremely grateful for the life that I've had and the life that I've lived, as far as sporting and things like that, for almost 15 years, my job was to play sport. It was something I always wanted to do as a kid. But if I'm honest, now, looking at it post-career, many years post-career, the challenges that I see, this is just coming up for me now, not something I prepared or anything like that. It's the challenges that I see in a hell of a lot of communities is that every kid wants to be a footy player. Every kid, particularly every Aboriginal kid, wants to be a footy player. And we do everything we can to possibly do that. And we see that that's our goal, that's our dream, that's our path. Without knowing that being in that system for a hell of a long time during my life, I can honestly and openly admit that being a professional footballer, more so rather than boxer, but I'll say as a rugby league player, was the most disconnected I've ever been as a person, because it took me away from the authenticity of who I was. It made me form a label. It made me form this identity that, in the early years, as playing in the lower grades, I wanted to be that, and then all of a sudden I could see myself on television and I was finally that. And then I was like, but what else now? What else can I do? It's always in search of something bigger, something more meaningful for us as young boys, young men, and then particularly as Aboriginal people. uh, across our country, because a hell of a lot of who we were, words are important. I can't say a hell of a lot of who we were was lost, because that would be ill of me to even say that. A hell of a lot of who we were was taken away from us without our control. And we were forced into a new way of life that has been challenging for us ever since. I'm someone who gets to go around and I guess even as a keynote speaker or somebody who speaks a hell of a lot, speaking is my job. Someone who speaks a hell of a lot, my job is to plant the seeds in people's minds to go away from here and just think a little bit deeper. Just question why it is that we feel or why it is that we think. Because everything, when you understand it, everything makes sense. Why you see the world through the world that you see, the lens that you see it through, makes sense when you understand every experience that you've encountered right throughout your life. So I ask people, who are we? Who are we as an organization? Who are we in our job? Are we effective in our job? One of the things that I said to Donna when asked to do this, I said, can you get me some stats around some stuff? And I'm not ever the person to talk about statistics and boring people with numbers and things like that, but I think it's important. I think it's important sometimes when we try to paint a picture. And it definitely come up throughout the referendum when the conversations were being had about our community. The conversations, again, it's important, words are important. The conversations were being had about our community. A lot of the time, not a hell of a lot of us leading those conversations. And the conversations were going, when we're talking about costings, we're talking about money, we're talking about things that, the things that happen in our communities now. And we a lot of people, we dove down a little bit deeper into what that is. And when you hear the rhetoric constantly that Aboriginal people get everything, all the money goes to Aboriginal people, all the money that happens in the Aboriginal affairs budgets, those sort of things, is getting done in a great way. But when the first thing I asked Donna yesterday, how are we around close the gap targets? Now, when you look at the latest data around close the gap, there's a hell of a lot of these targets not being met, and a hell of a lot of these targets that are actually going backwards. So again, I question, who are we? What's our job? And are we effective at our job? Because when we think about it, it's our people, the first people of this country that lived here for at least 100,000 years, that lived here on this country, lived with this country for a long time. And that's not pointing the finger at anyone. So please, like I always say, please don't get fragile about things when you get confronted with these type of scenarios around where the money goes and what happens and what budgets get allocated to how much money and what money's happening. Because when we look at, there's more money in mental health and well-being than there ever has been, ever. There's more education, more programs, more people working in jobs than there ever has been. Yet Aboriginal and Torres Strait Islander people are dying more, dying younger, being incarcerated more, and we form a lucrative business. What I mean by that, our disadvantage, the fact that we're dying more, the fact that we're dying younger, the fact that we're incarcerated more than a lot of people when it comes to demographic on the planet, we're creating a hell of a lot of jobs for people to work in. So again, the question asks, who are we? What's our job? And are we effective at our job? There are 35,740 First Nations people living within the Western New South Wales PHN. 11.36% of that population identify as First Nations people living within the PHN. The age distribution is 1 in 3, 39.9%, almost 40%. The Aboriginal population are under 15 years of age, and 1 in 4, 6.9%, are age 65 plus. So when we look at those numbers, 40%, the numbers that we just talked about, 60% those living outside the demographic we look at what impact we're having when it comes to close the gap. I'm always someone who challenges. Someone who challenges the conversation of what we do and how we need to do it better. LGAs with large First Nation population have high socioeconomic disadvantage indicated by high rates of employment, low income, low level of education, high risks, high rates of homelessness. First Nations young people are 16 times more likely than non-Indigenous people to come under supervision. Although First Nations people make up 3% of the population, we make up 33% of the prison population. Now, my work in and around trauma, I was doing all this stuff around communities, talking about experiences of who I was and how I was and the impact of what it had on me as a sports person. And I was invited as a speaker to the World Indigenous Suicide Prevention Conference in Aotearoa in New Zealand in 2016. And the conversation there was different. The conversation there didn't talk about mental health. It didn't talk about medication. It didn't talk about the challenges that were happening mentally and emotionally with our people. It spoke about the impacts of what all First Peoples around the world in the forced changes of how we live. So you think about that. You live, as a person, you live how you were brought up, how you were raised on the teachings of the old people that you were in the care of. And they live with the teaching, lessons, and upbringing that they learnt from their old people, and so forth and so forth. Yet, it's only 5 or 6 generations ago that I've been into communities that were colonized less than 100 years ago that literally recall the first non-Indigenous person coming to their community. And the forced change of behavior has been the biggest challenge. So to understand where we're going, we need to dive into what happened. And sometimes we can get to the point where we go, yeah, but we've heard it all before. We said sorry back then. Well, I challenge you. If things aren't improving, if things aren't going the way that they should be going, and we're dying more than ever, we're being incarcerated more than ever, and when you understand trauma at its depth, the forced changes of adapting to new behaviors, you understand that every negative behavior in community, my community, your community, every negative behavior that happens in all communities is a product of early adversity and trauma. So we're pushing billions and billions of dollars towards things that a lot of the time aren't having impact because we're addressing the wrong things. So I'll finish with that question in the beginning. Who are we? What's our job? And are we effective at our job? You have an opportunity to make change in communities. I said it yesterday to Donna and the people that were sitting around the table. We need, every day that we work into our jobs, we need to lead with purpose. Not lead with the fact that we get to pay our bills at the end of the week. We need to lead with purpose because literally people are dying. I always end with a quote from a guy called Dr. Bruce Perry in a book called What Happened to You. If anyone's read that book or if anyone's a reader, read the book What Happened to You with Dr. Bruce Perry and Oprah. It changes the conversation of not what's wrong with people, but what happened to people. When you understand what happened to people, you understand that everything Every behavior is a very natural response to a very unnatural environment. So to fix people's behaviors, we need to change our environment. Dr. Perry says, how ironic that the cultures that our modern world has marginalized are the cultures with the very wisdom to heal our modern woes. Over 500 separate nation groups, 2,500 different dialects of language. Peoples for thousands of years that worked with each other, worked for each other in the collectivist society and environment, and worked with the environment. There's an indication that if the people are sick, then the environment in which we're raising people is sick. Thank you.